Well, the figures reveal that the percentage of contacts traced and told to self-isolate by the national system stands at 58%, a figure broadly similar for the previous 3 weeks. But it's a very different picture for local teams, with almost all contacts being reached. 97% of people were contacted and told to self-isolate. Well, let's speak to Colin Hutchinson, who is a local contact tracer for Calderdale Council in West Yorkshire, also a Labour councillor. Thanks so much for joining us. So just explain, you've been working as a local contact tracer. How have you found it and how effective have you been?
That's right. We work in conjunction with the national system, so that if they fail to be able to make contact with somebody who's tested positive, they then pass on the details of those people to us, and we have another go by phoning using a local telephone number rather than a 0300 telephone number. Many times we manage to get through under those circumstances. If we don't, then we have the option of going and speaking to people on their own doorsteps. And using that combination approach, we manage to speak to most people who have tested positive. When we get the details of the people that they've been in contact with, though, the rules currently are that we have to return those back to the national system. We're not being permitted to follow up the contacts, even if they're in the same house as the person we're speaking to.
So just to clarify that for us, so if there is more than one person in a particular household, you would like to get access to those other people by default, because obviously they could be at risk.
They could be at risk. They may also be people who themselves have tested positive. But the national system doesn't put people together into households. It regards everybody as being an individual. And so households are getting multiple contacts from the national system and then sometimes from us as well. And subsequently, because there's now each person who's been advised to isolate is telephoned daily to ask them whether they're still isolating. If you're a contact of maybe the other 6 people in your house, that means you will be attracting 7 phone calls a day. And it's very, very common for us to call at houses when we ask them what we could do to help them in their isolation, say, can you please just stop the phone calls coming and let us concentrate on getting better?
And so when it comes to, because of course you're very much localised, you've got the contacts within the community. Do you feel, you mentioned that using those local numbers as well is quite helpful in being able to reach people. How important is that, do you think?
Yes, it's vital. And because we know the area, we know the businesses where people are working, we know the places they're going, we can bring that local knowledge into making sense of what people tell us about their movements and where they've met up with other people. We can quite quickly build up a picture of where people are being exposed to the infection, and where necessary we have direct links to our environmental health officers and public health officers, so that we can get them to follow up on our hunches, so that if there's particular businesses, offices, workplaces where procedures might be tightened up, we can give them the assistance to do that.
And when it comes to, when you talk about assistance, what do you mean by that? Because of course you know the streets, you know the areas. What kind of assistance are you suggesting, are you offering?
Well, environmental health officers are able to go and assess the ventilation of the workplaces, whether they are to make sure they're not crowding people together into offices or other buildings, whether people are actually able to work from home but being asked to come into work instead. On an individual basis, if somebody's running short of, is having difficulty getting food into the house, or running short of medicines, our volunteers can help with that. If there are problems, if they've got a large dog that needs walking, we have volunteers who will do dog walking for them. We can also try and make sure that they have access to the financial support they need, because the bills don't stop coming in just because you're not being able to go out to work.
Yes, absolutely. These are really fascinating details. Colin, when it comes to a kind of, do you have an average day when you get a contact? How many roughly do you get a day, a week? And then how successful are you in then chasing up those people?
As a team, we're currently getting about between 30 and 40 people to contact each day. Individually, because I tend to do home visits, I'm seeing between maybe 5 and 10 people in a day.
Right, that is interesting. And when it comes to the number of local contact tracers you have, of course, we're always talking about the vaccine, and we're very hopeful that we'll see that available soon. But test and trace, how important is it? And are there enough of people like you in your teams?
We have a team of 18 at the moment, and we are increasing. So we have enough people at the moment to be able to deal with the cases that we're getting. But we've got high hopes for the vaccine, but we're not going to see a great benefit from that this winter. So we need to be learning from the countries that have used the isolation and test and trace to the maximum effect. Countries like New Zealand, Australia, Cambodia, Vietnam, where their responses have been far, far swifter and more effective than ours, and have helped them to restore social lives, a greater level of economic life than we've been able to so far. So we need to be learning from the best.
Colin, it's been absolutely illuminating speaking to you. Thank you so much. Best of luck to you and your teams. Colin Hutchinson, a local contact tracer for Calderdale Council. Thank you.
Thank you very much.